on COVID-19 cases registered and over 230 deaths in Uganda, the surging cases have left many at a point of reflection, wondering how the country got here and what exactly went wrong.
Tonight, Colonel Mugume speaks to the experts. He seeks for a way out of Uganda's current situation. Take a look.
James Saka's 10 years at the National Information Technology Authority, NITA, has been described by many as a technological revolutionary decade. According to friends and workmates, Saka dedicated all his energies to lead the digital revolution in the country. But even when he retired in August 2020, his legacy could easily be traced. Coronavirus robbed him of all this. He's now normal. A tweet by Minister Frank Tumwebaze on the 9th of December would later announce his demise, caused by a virus that's slowly claiming lives almost daily. Uganda is now counting close to 30,000 COVID-19 infections. Today, the country has reached a point where COVID-19 cannot be controllable, experts say.
At stage 4 of the pandemic, what does this mean? The transmission has reached uncontrollable levels, and there are different pockets of transmission.
But how did we get here? According to the experts from the Ministry of Health, the tough lockdown measures had controlled the spread of the virus in the beginning. But pressure mounted, thus compelling government to create a balance between safety and the social economy.
As we open up the high-risk activities so that we have economic and social well-being and livelihood, we are opening up not because we are safe, but we are opening up so that we can survive.
Despite continuous messages to the public on observing COVID-19 standard operating procedures, this has not been the case. The public has been reluctant, and this explains the surging cases.
And people were advised to have SOPs for churches and mosques. But when you see them, do you ever watch them on TV? The masks are under the nose. They speak, they pull the mask down here on the chin. So what happens? We are exposing people. And what happens in the church? We sing, we shout. When we are praying, we are talking all the time. You have many people talking at the same time. So if they are infected, the droplets that contain the virus are going around and we are infecting people. So even when you are a bit of a distance apart, when you're speaking and when you're singing, when you're shouting, the chances of transmission are higher. So we have the religious congregations. Then the weddings grew bigger. Then the funerals grew bigger.
If the public remains as reluctant as it is now, projections from the Ministry of Health indicate that Uganda is headed for 1,000 deaths in the first quarter of 2021 and that the curve may not be flattened anytime soon. And the only hope now lies in the treatment and the vaccine. Colonel Mugume.